today, of course, rare diseases has many stakeholders, and we are covering these issues every month by our seminars. And today, our guest is a friend of mine, Rumen Stefanov, and he is a medical doctor and a professor in public health at the Medical University of Plovdiv in Bulgaria. And he is also an established and also directing the Institute for Rare Disease in Bulgaria. And he is a recognized expert in the field of rare disease policies at national and European level. He has established the national plan and also legislation, and now also chairing the national plan related organization in Bulgaria, and at the Ministry of Health. And in the international level, he is chairing the international collaboration of rare disease and orphan drugs organization, which is called ICORD. And we welcome him today to share his experiences with us. And thank you very much, Rumen, for coming here. And we are also looking forward to see you again together, that we are organizing ICORD 17th ICORD meeting in Izmir in November, and looking forward to see you all there.
Good morning, everyone. Very nice to be here with you. Also, thanks to Professor Uzbek for this kind invitation. As he said, we know each other probably 20 years and had the opportunity to work on a number of issues concerning not only our countries, neighboring countries, but also European projects. So shortly, my presentation, I'm going to speak today on 3 topics that probably would be interesting for you. I know that most of you here are researchers with interest of rare diseases, undiagnosed diseases. My specialty as a medical doctor is not tightly related with clinics, although I'm established and managing a clinical research center as well, but actually the main aspect of my work is more on public health and policy issues. Why? Because when I started working in the field of rare diseases, the term of rare diseases was not known by people, by politicians. Clinicians spoke about, well, some difficult to diagnose diseases, some genetic diseases, but the exact term rare diseases was absolutely unknown and unrecognizable. So I'm speaking about 2001, 2002, some more than 25 years ago. And then we decided that in order to work harder and to make better achievements, like nowadays, when even people on the street, if you ask, have you heard about rare diseases? I bet most of them should say, well, probably I have a relative, a friend with a rare disease, etc. The situation was totally different 25 years ago. Anyway, so the first topic of my presentation today will be about what we are doing in our Institute for Rare Diseases. Then I'm going to introduce some of the things we do at national level. And finally, I will bring to your attention the current projects, research projects we are working on. They're international projects, and probably you might be interested in viewing the results, probably contributed to some of the projects. Of course, at the end, I'll be glad to answer any questions you may have. And of course, I will be open for further comments and communication even after the meeting today. So let's start first with our Institute for Rare Diseases, as we call it. That's the main website. It runs in Bulgarian and English languages, and it's probably the richest site with information on rare diseases for our region, not only for Bulgaria. As I said, everything started 2004, that's 20 years ago, when we established the Information Center for Rare Diseases and Orphan Drugs. We started in Plovdiv, that's my hometown, the second town in Bulgaria, a very nice one. I love it. In 2004, we started with the Information Center, and this Information Center operates, still operates. There's a person, medical doctor, specializing in endocrinology, volunteering, and we receive requests from all possible ways, by phone, by email, by website, by people coming in our center, asking about a rare disease for themselves, for their child, a doctor that has a patient with rare disease that not knowing what to do, how to forward the patient. Of course, in the beginning, most of the requests were coming from patients or parents. Later, a lot of journalists and researchers started to contact us, even students needing information to make a homework essay on a rare disease, asked for support and materials. And now I observe that we have also many requests from physicians from all over the country that have a patient with a rare disease and asking about information where to forward this patient to expert center in new countries, a topic I'm going to discuss a little bit later. Of course, we keep repository of those answers and questions. We have a huge database of questions and requests for rare diseases that is updated and maintained regularly. Then in 2009, we established our clinical center. It's a separate building with several specialists. And in order to sustain financially, we also work with the National Health Insurance Fund with regular patients, actually. Every patient may attend a visit, not only rare disease patients, otherwise it's impossible to sustain financially. And since 5 years, maybe, or 6, we started also working with undiagnosed patients. Here, the procedure is not so different like everywhere in the world, including in your institute on a regular basis, usually monthly. We collect requests, then we ask all the medical documentation to be informed with the analysis and the patient pathway up to now. Of course, we invite the patient for consultation, communicate with other colleagues from different expert centers in the country, eventually advise the patient to go abroad in EU countries for further diagnosis, depending on our decision. Sometimes we succeed to put the diagnosis. Unfortunately, it's not so high percentage as everyone would like, but that's the reality. No one is perfect, you know. In 2013, we established the next unit, that is the Center for Analysis and Health Technology Assessment. Actually, with all those units, we try to provide solution for significant problem from our point of view that would improve the visibility, the access to diagnosis and therapy for rare disease patients in Bulgaria. So what is this center working? It works with industry in order to help them and to prepare health technology assessment for new innovative therapies and diagnostic procedures. And this unit, this center is specialized only on rare diseases and orphan drugs. European legislation requires all new drugs to undergo health technology assessment before health authorities decide whether to reimburse the drug or not. But we're not interested in all drugs, we're interested in orphan drugs only, and drugs for innovative drugs. So I would say most of available innovative and orphan drugs in Bulgaria has passed under our consultations, and we have worked extensively on this health technology assessment that includes not only the efficacy and safety of the drug, but also considering some financial issues like the budget impact on the healthcare system, comparing with alternative therapy if there is any ethical issues, legal issues, and at the end, providing recommendation to health authorities how to proceed with this drug. I think this was quite important. And finally, in 2019, we established the RareBoost Solutions, the fourth unit of our institute. So actually, our institute is a consortium of those 4 units: the Information Center, the Clinical Center, the Center for Health Technology Assessment, and the RareBoost Solution. And the RareBoost Solutions is our unit that is trying to work strategically and try to foresee the future. I mean, we are actively looking for potential research opportunities, also trying to find the patient pathway, the healthcare system, to understand why patients are delayed in their diagnosis so much, and what can we do to optimize and improve the healthcare system so that to shorten the time between the first symptoms and putting the correct diagnosis if possible. So with RareBoost Solutions, we work also on patient support programs for some of the rare diseases, where we have a team that is trained how to support patients in getting their drugs regularly, doing required exam at every 6 months or every 1 year, just to maintain quite high level of compliance to the therapy. You know, this new therapy, innovative therapy, is extremely expensive. So if the compliance of patient is low, it will undermine the total efficiency and reason of providing this therapy. What we have done for those 20 years, we organize every year an annual conference on rare diseases, usually in September, early September, where we gather practically all people in the country working on rare diseases, not only clinical doctors, but also geneticists, researchers, biologists, everyone working in the field, patients also. Besides rare diseases, you just got the idea that we are interested in health technology assessment. So 10 years ago, we started also with specialized symposia for health authorities, trying to promote health technology assessment as a valid method for making decisions. It's not enough that health authorities, Ministry of Health or Ministry of Finances, just a random person says yes or no for the decision whether to provide access to new therapies, but we need valid scientific methodology to do this with health technology assessment. And the Eastern European conferences we started 15 years ago. One of those Eastern European conferences was organized also by Professor Beck in Turkey 15 years ago, probably. Yes. Speaking about international cooperation and publications, we have been active participants in all major rare disease EU-funded projects with more than 80 publications in peer-reviewed journals with impact factor. And of course, we collaborate with urologists, with orphanets, with I-courts, and practically all countries in our region. And in 2023, the President of Bulgaria recognized all our efforts with his official honorary badge for the achievements we get. I have just prepared a very short movie that we used last year of celebrating our 20th anniversary, trying to cover
rare diseases.
the main topics.
Is the first comprehensive and coherent organization dedicated to rare diseases and orphan drugs at both local and regional levels in Eastern Europe. Our primary objective is to accelerate access to innovative treatments and enhance patient outcomes for individuals with rare diseases through holistic, ethical, and sustainable solutions. Our journey began in 2004 with the establishment of the Information Centre for Rare Diseases and Orphan Drugs, which meets the needs of rare disease patients and healthcare professionals by providing reliable and comprehensive information. In 2009, we founded the medical centre RareDis, offering opportunities for diagnosis, treatment, follow-up, rehabilitation, and tailored patient support programs. This was followed by the launch of the Centre for Health Technology Assessment and Analysis in 2013, the scientific journal Rare Diseases and Orphan Drugs in 2015, and RareDis Solutions in 2019, enabling our team to professionally map the critical milestones of the rare disease patient's journey and propose sustainable healthcare options to achieve improved patient outcomes. In 2021, amidst the COVID-19 pandemic, we set up the virtual Congress venue, ensuring that we remained connected with stakeholders and delivered all planned services, despite limited networking opportunities. The Institute for Rare Diseases team continuously raises awareness for rare diseases, frames holistic and customized patient support, provides education, disseminates knowledge, and facilitates access to innovation through national and regional conferences, as well as our social channels, website, Facebook, LinkedIn, and Instagram. We develop sustainable partnerships with all relevant stakeholders, including health authorities, the National Association of Medical Students, industry, the National Alliance of People with Rare Diseases, medical societies, and clinical experts. At the European level, the Institute for Rare Diseases actively contributes to 15 funded projects, sharing expertise, transferring knowledge, and best practices with partners across Europe. We are a trusted partner of European organizations like Orphanet and Eurordis, and global rare diseases organizations like ICOR. We have also contributed to the development of rare disease organizations in Armenia, Georgia, Romania, Russia, Serbia, North Macedonia, and Turkey. In 2023, the Bulgarian president awarded Professor Rumen Stefanov, chairman of the Institute for Rare Diseases, and representatives of the National Alliance of People with Rare Diseases with the President's Badge of Honor, acknowledging their role in framing and serving the rare disease community. At the Institute for Rare Diseases, we strive each day to accelerate access to innovative treatments and improve rare disease patient outcomes through holistic, ethical, and sustainable solutions. Happy 20th anniversary.
It's a very fancy video, but just in 2 minutes summarized what I tried to explain for 15 minutes. Now I would like to continue with the second topic that I consider much more important. It's about our registration on rare diseases. So I know that here in Turkey you have a national plan for rare disease. That's great. And for sure that's the right step, the right first step to increase awareness, to organize the policy on rare diseases in your country. Without a national plan, it's really difficult to convince health authorities, politicians that rare diseases are priority and are important priority. But we had a national plan. Actually, Bulgaria had the national plan, the second country in Europe after France with national plan. And we finished this national plan, and what happened actually, everything stopped because those national plans are political documents, which are important political documents, but they do not provide solutions in long term. And you know, the average duration of a single research project is a few years, 3, 4, 5 years. And at the end, when we have some results, we need a way to continue our work, to upgrade our work, to link with other researchers, clinicians, to move further. And national plans do not allow this to happen. Why? Because at the end of the national plan, the only thing you can do is to ask health authorities for second national plan, then for third national plan. And it's not an easy task. I remember in order to convince health authorities for our first national plans, it took several years of meetings, conversations with different politicians. They change, new people come, you start from the beginning. I'm pretty sure you know what I'm explaining. So at the end of our national plans, which I again repeat, it's a must. We should have a national plan, at least one in the beginning. We decided that it's not very wise to continue in this way. And we concentrated together with patient organizations, together with medical societies with which we collaborate very close, especially those medical societies, you know, that are very strong, like neurologists, like hematologists, endocrinologists, that concentrate a lot of patients and importance for the healthcare system. And together with them, all together, actually convinced health authorities that we need legislation. We need a legal document that will be adopted officially. And as you know, legal documents, they don't have an end date. They're once adopted, they're existent till something extraordinary happens. And the second issue is that if you have a legal document, then the country is obliged to provide all the organization and funding to make sure the requirements, the articles in this legal document are happening in reality. And finally, in 2014, we convinced politicians in Bulgaria to adopt this regulation on expert centers and registry for rare diseases. I remember very well, it was almost close to acute myocardial infarction situation because the current Minister of Health had to resign because of political changes. And I don't know how, by miracle, we convinced her, it was a woman, to sign the order for this regulation the day she resigned. We were very thankful for this, of course, because once signed, this regulation came into force and is still into force. And this regulation is extremely important. I think it changed a lot the situation with rare disease in Bulgaria because it's a legal document valid on the whole territory. Everyone in the healthcare system is obliged to follow this regulation. And with this regulation, we established several key elements. First of all, we have official committee on rare diseases. This Committee on Rare Diseases is defined by the Minister of Health officially with the power to communicate, to be visible, to decide on issues related to rare diseases. I had the honor to chair this committee since its beginning, and it includes not only medical specialists. It consists of 16 persons, half of them are medical specialists, famous professors in different work here, but also it includes people, experts from Ministry of Health, from the legal department of Ministry of Health, patient representatives with the right to vote, to patient representatives. So those 16 persons actually represent more or less all interested parties, the health authorities themselves, the medical societies, and patients and researchers as well. This committee, we meet every 2 months, more or less, and we do a lot of work. First of all, we are responsible for the so-called national list of rare diseases. With this regulation, we created the so-called national list of rare diseases. What is the idea of this national list? With this national list, actually, everyone in the country, even patient organizations, may propose a rare disease to be included into this national list. So they apply for insertion of a rare disease in the national list with a standard form. We ask information about this rare disease, its frequency in the country, proof that this disease is rare, And if there are some algorithms for prevention, diagnosis, therapy, follow-up of this disease, we ask the experts to explain and to provide these algorithms. Then the Committee for Rare Diseases makes a review of the application, and if approves, then the Ministry of Health issues a new order, and this rare disease is included on the national list. Once included into the national list, all the healthcare services that are required for the correct prevention, diagnosis, and therapy of the rare disease must be provided also by the other structures of the healthcare system. Not automatically, but they are obliged to make it in a reasonable time period. Moreover, if there are experts who think they are quite well trained in the diagnosis and therapy of these rare diseases, may apply to the Commission and be officially designated by a special certificate and order as an expert center for rare disease X, let's say. With this label, in the moment, they don't get enough money in cash, of course, but I hope they will do very soon because we're working on this also. However, with this label, they may candidate and become partners of the European reference networks. I hope you have heard about this initiative of the European Commission, the ERNs, European Reference Networks, virtual networks of expert centers across EU countries that were created after the adoption of the Directive for Trans-Border Healthcare of EU. So in simple words, this directive provides the right for every patient in EU country to get access to the most modern and accessible diagnosis and therapy for his or her rare diseases, irrespectively in which country he is living. So if a patient in Bulgaria is diagnosed with a rare disease that cannot be treated or diagnosed in Bulgaria, but can be diagnosed or treated in, let's say, Germany or Italy, he has the right to go there, get the service, and the health insurance fund is obliged to pay for all the expenses. Extremely important and I would say valuable approach. What else? Those expert centers, of course, once labeled, they usually are provided with the right from the National Health Insurance Fund to subscribe to the so-called expensive therapy. So a lot of patients concentrate in those expert centers. They are visible. Doctors are proud of working in such expert centers. Probably industry is also interested in collaborating with those expert centers because they see there are people, experts working there. And what we are now doing, we are trying to convince health authorities to provide some extra funding budget for those expert centers to cover their administrative costs, because all this work, unfortunately, requires persons to do the quality assurance, the administration, communication. It's inevitable. So the work of this, our commission is absolutely transparent. A few days after the end of the meeting, the protocol is published online. Every person can open and read the discussions and decisions of the commission. No under the table negotiations. Practically everything we do is 100% transparent. I already explained about the list of rare diseases. In the moment, we have 267 rare diseases officially in our national list, and the number is increasing. Well, we have some opponents, I should admit, who are against this approach with the national list, but I still insist it's extremely important. And the opponents say, why don't we use the Orphanet list of rare diseases? Well, we can use, and actually we are using Orphanet codes because, you know, that's most of rare diseases do not have ICD code. So the healthcare information system is not able to record this exact patient with this exact rare disease as a separate unit, and we cannot electronically follow up what's happening with this patient. So on the requests for inclusion of rare diseases, we always ask, besides the ICD code, the doctors to provide and the orphan code. But for all of you who are familiar with OrphaNet database do not include this precious information about the protocols and algorithms for prevention, diagnosis, therapy, and follow-up of rare diseases. What we ask from people who candidate for rare diseases, because without those algorithms, just using a name of the disease, I don't think we are of any help to the healthcare system. Why? Because the dossiers of those 267 rare diseases are published on the website, and every physician, even at night, may go and open the dossier of these rare diseases in the wrist and read up-to-date, clinically verified information about this disease. So I consider this of a huge help for the healthcare system and improvement the quality of the healthcare services, besides just putting a list with names and codes, nothing else. So I'm pretty convinced that there is a reason of adopting such a national list. There's no delay, administrative delay in adopting diseases in this list if they're candidates. And of course, there are some efforts needed from experts and clinicians to prepare this dossier, but they are the experts. If they want to be labeled as experts, sit down, separate several hours and fill this application form. It will not take more than few hours to complete it, if you're the real expert. A few words about the expert centers. Those expert centers, their legal requirements. I'm sorry that the text is in Bulgarian, but I don't have the English version. I'm quite sure there is an English version of this regulation, but maybe we have to translate it. However, there are few mandatory things that the Commission always looks for. The first thing is the multidisciplinary approach. We always require proofs that this expert center is providing multidisciplinary approach, not only geneticists or just clinicians or just physical therapists, but they must prove that all necessary services for this patient, including diagnostic, therapeutic, follow-up, psychological support, whatever these patients are needed, are provided by the center. The second issue that is mandatory, and we have several cases that we return to the expert candidates their application, is that they must provide continuity of the support. I mean, if they are following up a child with a rare disease, they should prove what is happening with this child when he or she ends 18 years. Who is the doctor? Where is the clinic where this child will continue to be cared by an experienced doctor? Of course, the expert center should declare the algorithms they are using, and those algorithms, as I explained, are included into the list of rare diseases. So you see how all the things are linked together and connected logically between each other. And currently we have 34 officially designated expert centers. As you can guess, most of them are in Sofia, in our capital, but well, that's the most populated city, and there are many huge hospitals there. But geographically, we have expert centers in approximately covering equally the territory in Bulgaria, also in Plovdiv, in Varna, and Pleven. We maintain the Commission official registry of those expert centers, so everyone, doctor, patient, may find the contact information, the phone number, the address, also the rare diseases for which this expert center is designated for, and they can contact the expert center 24/7. Finally, I would like to share some of the projects we're working on. This is a very interesting project about epidermolysis bullosa in Europe, about the socio-economic burden. There was nice project 10 years ago called Burk RT. This project achieved a lot by identifying the burden, the socio-economic burden of rare diseases for the healthcare system 10 years ago. And it was very interesting as a methodology how to choose which diseases to be included into the project, how those 10 diseases should be selected. And that's what we just discussed before our meeting today with our colleague. How do you decide and prioritize which diseases to be included in your research projects and ideas? It's just someone told me, or maybe I think this is fancy. We had such extensive discussions. We actually needed 1 year to decide on the methodology, how to prioritize and choose which diseases to be included for research and what would be the output, the added value of this research after that. So for those of you who are interested, I can send you the methodology behind this. We published it and it's a very cited article. So we are repeating the analysis on one from those 10 diseases, epidermolysis bullosa, because there are some important changes to this disease. 10 years ago, it was untreatable. Now we expect therapy about this disease. And one of the interesting findings we concluded 10 years was that actually at that time, most of health authorities said that we pay a lot for therapy for rare diseases, but after the end of the study, we proved that actually the cost of the family society is much higher than the cost of the health authorities for drugs when we calculate all the additional expenses, not the drug only. Anyway, the second project I'm pretty sure you're familiar with, that's the orphanet data for rare diseases. On 4th of April, after 2 weeks, we have an important meeting in Sofia with health authorities and expert centers, because now we are trying to convince health authorities to include orphan codes into the national information system. So the software that all the medical facilities, hospitals and clinical centers are using to provide them with the option to add the orphan code for rare diseases. Probably in the beginning, we're going to start with those diseases which are into the national list. And as a second step, as a pilot study, and probably as a second step, we'll update with the whole orphanet data. That's quite difficult from technical point of view, as I realize, because the nomenclature of orphanet is changing a lot, and IT specialists who are responsible for the national information system are afraid of very frequent updates of the software, some bugs, etc. I understand their concerns. So I hope, at least in the beginning, we're going to start with those diseases nationally, so that physicians, doctors in their practice will put this extra orphan code to the patient, and later we can see what is happening with those patients, because we will be able to identify them into the healthcare system. And probably the most interesting and important project currently we are in is Screen for Care. This project started 2021 with a duration of 5 years. It's an innovative medicine initiative project. These projects, IMA projects, are how funded by European Commission, how funded by the industry. It includes 45 partners from most of European countries with a huge budget. You're familiar with this diagram, and the patient diagnosis odyssey with the critical point at birth the importance of developing sustainable strategies for newborn genetic screening at the second stage, at early onset, with the option to have algorithms to flag patients for some of the rare diseases, and when patients start going from one healthcare provider to another, and we need another tool to summarize the symptoms and to propose a possible rare disease. So with this project, there are 5 clinical studies to be done. First, a pilot study for treatable diseases, then a pilot study for actionable diseases, rare diseases. There will be a pilot study with symptomatic whole genome sequencing screening, and also screening model from electronic health records. So it will be developed a new software screening large databases with electronic health records from hospitals, from clinics, trying to detect patterns which are associated with a rare disease. And finally, there will be a phenotype imaging with multispectral optoacoustic tomography. And these are, in short, the 6 stages. Our work was on stages 1 and 2. Our team in our institute worked extensively, and we published several important articles about the availability of resources and their level of usability for the aims of the project. We did a landscape analysis of available databases, biobanks, repositories, if they are compliant with the FAIR principles. So based on our work, our colleagues from the work packages 3, 4, and 5 now are planning how to proceed with the pilot newborn screening activities, as well as developing the artificial intelligence software that will be able to crawl data among anonymously, of course, among hospitals and try to identify flag patients who are suspicious for a rare disease. And so finally, as another example of positive activity for rare diseases, that's the first Bulgarian stamp dedicated to rare diseases on the right that was issued last year from Bulgarian Post Services. Well, it's another way to make popular what we are dealing with those kind roses, representing the different stages of life, DNA, etc. It was created by a young, dedicated painter who really invested his soul into the design of this official stamp. Well, that's all I have prepared as information. Of course, I will be happy to answer any questions you may have or discuss an issue that probably you might be interested. Thank you for your attention, and hope to see you again, as Professor Beck said, in November on our iCourts annual conference that will be here in Izmir, and that will bring also some of the most famous specialists on rare diseases from all over the world as international speakers. Thank you.